Concussions can be dangerous, and getting the right treatment as soon as possible is critical to recovery, especially for children whose brains are developing. But concussions can be especially difficult to assess in children who often have trouble articulating their symptoms. Dr. Frank McGeorge is here with efforts to help improve the process.
Concussion recovery is not one size fits all, especially in kids. Now researchers in Ohio are working on a way to help predict who might need more time to recover.
The first thing Thomas Helsel remembered after a hard hit on the football field was being surrounded by his concerned coaches.
My head was throbbing, and we decided that it was good to go in to get checked out.
Doctors in the emergency department did some standard testing for a concussion, and then one test that wasn't so standard.
I remember it because I thought it was odd they were asking me for a spit sample from a concussion. I was like, how does this relate?
The saliva sample was part of a study to discover differences in kids who recover normally from a concussion in a few weeks and those who experience persistent symptoms that last a month or more. The research is a collaboration between Nationwide Children's Hospital and the Institute for Genomic Medicine, whose scientists examined molecules called microRNA in the saliva of pediatric concussion patients at initial treatment, as well as 2 weeks and 4 weeks after their injury.
We can identify in a tube 800 different microRNAs, which one is which, and then the technology allows us to count what microRNA is there and how much of it is there.
Using this method, scientists identified 13 microRNA that are expressed differently in children who experience persistent post-concussion symptoms.
If we can identify that at the time of injury, it can lead to earlier clinical intervention and really like a more personalized approach for caring for these children.
After some time off for a full recovery, Thomas was back on the field for his senior year.
I'm healthy, and I think I have, big plans ahead of me.
Now, scientists plan to expand on this research and hope that eventually saliva samples can be used by doctors to develop the most effective treatment plan possible. Back to you.
Thank you.